Ladies and gentlemen, welcome to the episode before last in our series of education exchange show on cable channel 21 and cable channel 18, as well as YouTube and many other sources for your information. It's my privilege tonight to welcome Susie Poulton. Susie Poulton is the Director of Health and Student Services in the Iowa City School District. And Susie, welcome to our show.
Thank you. Thanks for having me.
We are very happy to have you here, and I have about like 400 questions for you tonight.
Okay, let's get started.
And concerned citizens. And but we really would like to seize the opportunity tonight to, on behalf of a lot of people who work closely with you, thank you for the efforts you're doing. Now I know that your load has been increased and you are doing a lot of things with the families, with the mental health issues, with the free medical clinic in the district, as well as the physical education curriculum and all these responsibilities. So I will ask you first to give our audience here an idea who you are and how did you come to be that important person in our lives.
Well, first of all, thanks for having me, and I'm not sure that I'm such an important person, but I sure do enjoy the job a lot and really feel strongly about the health of our children. So I came to the district in 2004. I'm a pediatric nurse practitioner, and I've always been very interested in school health and worked at Grantwood AEA as a special education nurse consultant there for 6 years, and then worked at university hospitals for many, many years. So I just feel strongly that children's health is very important to their learning, and that in order to be optimal learners, one must be healthy, general health, physical health, mental health, good nutrition, good balanced life, and then bring the children to school, and then we can teach them, but their health needs have to be met first.
So do I understand that your work, Susie, if you allow me to call you Susie, your work involves clinical as well as bureaucratic or desk work?
Yes.
Because, you know, I know that you are now having a lot of administrative responsibilities. Do you miss your clinical interaction with patients and so on?
Well, my role has changed to be more administrative and oversight, but I still make an effort to make contact with children. And I have some great staff that I work closely with, the school nurses and our Family Resource Center workers and Youth and Family Development Coordinator in that group. So I'm always still pretty involved, and I do enjoy both aspects, the clinical and the administrative oversight.
Can you tell our audience how many staff do you have? Like how many nurses do you have covering responsibilities in various schools?
The district has 6 full-time school nurse positions. We have health associates at the junior high and high schools. And then we have family resource centers or mental health case managers in all of our buildings.
And this structure, do you think is enough to deal with all this responsibility?
Well, I think we're doing a good job, actually, and I think by working closely together, we are able to meet the needs of students. I do believe we could use more school nurses. That always seems to be an area of great need, and over time that number has increased, and maybe we'll continue to work on that.
Does a nurse that would like to work with you need certain training or preparation in order to be working in schools, even though she has or he has been working in hospitals?
Well, the school nurse position is really a public health nursing kind of position, but experience with pediatrics is very important. So some of our nurses have come to us from the hospital or from a clinic setting, and they do just fine. It's a very independent position, and it takes I think it takes a unique person, but having really the background in pediatrics is most important.
Now let us begin our conversation.
Okay.
And I will start with some concerns by parents. First of all, some parents told me that you have something called free medical clinic.
Yes.
What's that?
We have Healthy Kids Community Care is a school-based health clinic that started 5 years ago. It's a community collaboration. It's funded by United Way and the generosity of Mercy Iowa City, who established an endowment for us through the Community Foundation of Johnson County. We have the clinic 2 days a week, Tuesdays at Southeast Junior High and Thursdays at Northwest Junior High, staffed by a pediatrician who is given to us by the University of Iowa, and then a pediatric nurse practitioner from the College of Nursing. The clinic is focused on meeting the needs of uninsured, underinsured, or children maybe who are new to town and do not have established care with the healthcare provider. We do the whole gamut. We do well child care, immunizations, and sick child care, prescribe medications, and then we will refer children on to specialty care as well. We serve about 280 unduplicated children every year, and it continues to grow slowly, but it's been a great resource. It's the reason we went to school-based is because it's just much more accessible, and we have parents do not have to be at the appointment. We need their consent, of course, and we need health information on their child, but our school staff, like our Family Resource Center staff or school nurses, can transport the child to the appointment if the parent can't be there, and it helps connect the parent and the child to the school as well. So it increases accessibility.
And the mental health issues have been piled up on my desk last few days when they knew that I'm going to see you.
Oh, okay.
And some of them are related to what do you offer, how do you coordinate your work with the psychologist and psychiatric treatment. Some of them are related to how do you distribute the medication. But I have had a lot of issues related to the mental health service. So can you talk to the audience about what you offer for the mental health care of their kids?
Okay. Well, due to the funding from the Safe Schools Healthy Students federal grant that we received 4 years ago, we have been able to put mental health case managers in all of our buildings. And these are social workers, typically, are someone who has some background in mental health, who work directly with families and help them access resources. We also work with community agencies such as Four Oaks Family Systems, United Action for Youth, to have counseling available for students at the school level. And then through the school-based clinic, Healthy Kids Community Care, we have a child psychiatrist from University of Iowa, Dr. Nancy Beyer, who is in the clinic 2 mornings a month. And again, it's to serve those children who do not have health insurance or need to access a psychiatrist quickly. The wait to get into child psychiatry at the University of Iowa is about 6 months to get an appointment. And so these are kids that have more immediate needs. We're not there to criticize or to say a child needs medication or whatnot, but we want to make sure that kids have the access to those resources, to those mental health evaluations, and to any services that they might need. Now, for some, getting mental health counseling at school is not an option. They prefer to go to their private practitioner, which is absolutely fine. But for others, it's much easier. It's much more accessible for them to see a counselor right at school during their school day or right after school. And so we offer that as well. And we are seeing more and more students with mental health issues. Anxiety is a huge concern for our children, and depression. We're seeing more and more kids with bipolar disorder. So we want to make sure that they can access the resources and get the help that they need. So often it just needs maybe some short-term counseling, perhaps medication or a combination of the two, and then they can get on to what they need to do, and that is to attend school and be a successful student.
One of the problems that we faced, at least during my professional career, is the area of teenage suicide.
Yes.
And unfortunately, statistically speaking, this has been rising steadily. And what do you do in order to, I don't want to say to prevent this from happening, but at least to safeguard against the possibility of a child who doesn't find help and go ahead and do it? What do you do in order to, what are the signs that you instruct teachers to look at when you train them, that this can be an indication that this kid may be vulnerable to this?
We have done a lot of professional development and continue to do, primarily through the Crisis Center, on identifying those kids who might be at risk for suicide and what can be done to prevent. And it's all about recognizing the symptoms and then getting them some professional help immediately. And contacting parents, because often parents don't even realize that their children are in danger. We also are trying to do more screening kinds of things. So we now implement Teen Screen, which is it comes from the University of Columbia. And it's a mental health screening. It's a questionnaire that focuses on depression, anxiety, and substance abuse. This is offered to all students in health education, and we've done it at Tate High School this year as well. It's voluntary, but it's helped us to identify some kids who were on no one's radar, who were maybe depressed or severely anxious, and we're able to connect them with some resources, whether it be counseling or psychiatric care.
So the novice teacher that should be prepared to feel the pulse somehow of the kids, and would call you.
They would call.
I mean, walk me to the procedure.
Okay.
They would call you, or they report, or what?
They would contact either the school nurse, the guidance counselor, or the mental health case manager to say, I'm concerned about this student. And then depending on the situation, one of those people would intervene. They may have a conversation with that student. It really depends if someone in the building has a relationship with that student already. It's very important that not just a stranger, meet with that student. You want to have someone meet with that student who knows the student and have further conversation.
The student can trust.
Yes, have further conversation with that student to find out if that student's getting any kind of mental health counseling. Parents need to be notified so they can be brought into the loop, and then some decision is made on what's the next step as far as a referral goes. If it's imminent, then we will have staff who will escort that child to the emergency room with the parent support and ask them to be there as well so we can get medical care for the child immediately. The mental health case managers that have been in the school district the last few years, I think they save lives because they work closely with these kids and their families and help them access resources. And so I think that they're doing some great work. And it's all about relationships. It's all about establishing a rapport with the student and building that trust.
The next part of our conversation will be about some controversial issues.
Okay.
And it's up to you. If you want to pass, that's fine. If you want to address them. The first one is, and this has been, as a matter of fact, in an email to me last week, about venereal diseases and how far you can interfere without getting into trouble with parents. It's a privacy issue. With whatever it can be misinterpreted or mistaken as something not really helpful. So what are the boundaries that where a kid that has, let us say, some signs of a venereal, some rash, some herpes, some whatever, what kind of help this kid can find without being exposed to everybody?
This is tough. And I'm sorry to say that I don't have a real good handle on the occurrence of sexually transmitted diseases among our student population. So we won't know unless a student comes to us, whether they go to their teacher or their guidance counselor. They can sure go to the health office in their building and talk to the health associate there or the school nurse. And we will definitely work with them to get them to the right place. By law, they are protected under the Privacy Act, that we cannot divulge any information to parents about sexual health unless the child gives us permission to do that. But we also are not in a position to provide treatment for that sort of thing. Now, a child could be seen in our school-based clinic, the Healthy Kids Community Care. At this point, it would be education, and we would refer them on to a private doctor if they have health insurance, or to Planned Parenthood or some other clinic here in town for further evaluation. We do not treat sexually transmitted diseases, and we are not testing for them currently, but we will definitely get them to the right place to have the testing done and the treatment provided. We also will do pregnancy testing in our clinic, but we do not do any kind of reproductive care or prescribed birth control. But we have good relationships with the different services in town to get kids to the right place. So the kids need to confide in someone. It's not something that we can do a survey of all kids and try to get that information. That would be violating privacy. But if they confide in someone in the school, then I would hope the teacher would know to contact the school nurse and get them to the right person.
In some districts, I heard or I saw in the media some guidance counselors or school psychologists talk to kids about contraception. They even have some condoms to distribute,
sure,
and so forth. Do you allow this in the schools in Iowa City?
Absolutely. It happens through our health education curriculum. So from early on in elementary school, we're talking about sexual health. And we use the Wonder Years. It's a puberty curriculum, and that really is at the 4th, 5th, and 6th grade level. And then in 7th and 8th grade, it's the personal development class, and then the 9th grade health curriculum. So we definitely talk about it. Our teachers provide a lot of information on this and about the resources that are available to kids. We are not handing out condoms at this time. There's some controversy on that, pros and cons. I would be reluctant to hand them out without education. Yeah, right, with it. But I do feel we provide good basic education through our health education curriculum.
Let us continue our controversial issues.
Okay.
Now, what do you do? What do you do with agencies in the community that offer help for young teenagers in the area of domestic violence? We have a wonderful service here represented by the domestic violence program, prevention program. And we have the rape victim advocacy program, which is doing a noble job.
Yes.
And as a matter of fact, today, just today, which is June 4th, the year 2012, they are announcing their readiness to offer training program for volunteers through the month of June.
Okay.
And maybe it's a good chance for us to ask the community to help them doing this, because they really save lives. What kind of cooperation you have with those agencies?
We have wonderful cooperation. We use the rape victim advocacy group frequently. If a student would come to any school staff member, then again, making contact with that guidance counselor or with the school nurse, and we have called on them to come and meet with the student to learn more, and then to get them, again, referred to the right place, whether it's contacting the police, getting them a medical evaluation, that sort of thing. So we have a nice working relationship, and they have come to the schools and helped us in these situations. Again, we don't, only unless the student comes to someone, we are not going to know that they need the help, yes. Or there's some signs, you know. We also have friends of the students who might come to us and say,
Yes.
I'm really concerned about my friend.
Yeah.
And we take that very seriously, and we will try to explore more. Again, in a very professional way without violating the confidence, the confidentiality. But we are here to, we want to help the child, help the student.
As a matter of fact, when I taught health curriculum at the alternative school, I had tremendous help from Carla Miller.
Oh, yes,
Of the rape
Yes.
advocacy program. She would come with her staff
Yes.
and explain things, and in this case, I would leave the classroom for them because, you know, most of the kids would not be there, would not like the teacher to
True.
be there, but those are
Very true.
professional people. And I tell you, I mean, they were tremendous help for me.
They are
Tremendous
tremendous, yes. And they have helped us with just individual cases many
Yes.
times, yes.
We continue still. We have a couple of questions, difficult ones. But with all the tasks you are dealing with, I think this is a piece of cake for you.
Okay.
Right? So let's go now to the issue of obesity.
Oh, yes.
This is a very controversial issue. What is the boundary? Who is obese and who is not? And if the culture of a person sometimes dictates the kind of food they eat at home, how come this person will go to school, this individual, and they say, oh, no sugar, no this, no that? Do you feel the tension that sometimes this issue creates between the family in one aspect, on one hand, and the school system and the health program on the other?
Yes. This is very controversial. What a person eats is very personal. And we have put together a wellness policy. It was implemented back in 2006, and we feel like we have to be a good steward, and we have to be role models as much as we can. So we have made changes in our student vending and our lunch program and that sort of thing. We also do some assessment. We look at the BMIs of our 4th through 12th graders. And at 4th grade, about 18% of our kids would be considered overweight, but by 12th grade, about 40% of our kids. So we are seeing a huge increase over time. We really, like I said, try to serve healthy foods as healthy as possible within our resources and emphasize physical activity the best that we can and that sort of thing. But it's a big problem. It's bigger than just the school. It's truly our society, and it's truly, you know, culture. And again, it's personal, and some people take it very personally if we are even assessing the BMI of their child. It's really all about information. We want to provide information so parents are informed. And there just are not a lot of resources for weight management, weight loss for children.
Yeah, I recall 7 years ago when David Franker championed this cause of eliminating the soda and Coke and Pepsi from the vending machines in school. And I could see the letters to the editor, and a lot of people were very angry. I mean, who are you to say this to my kids? And it was difficult battle to fight. It was not easy.
Absolutely, but you know, now those vending machines
They're gone.
Are pretty much gone, or else they have very healthy things: water, fruit juice, low calorie drinks.
Right.
And more of our junior highs and high schools shut them off during the day. So, and people aren't really complaining. We also removed all the sports drinks from our a la carte menu and that sort of thing. I think people adjust, and they'll go elsewhere to get it. They'll go down the street to the gas station or to Wendy's and buy their Coke, that sort of thing. But I still feel strongly that we have to be the role models, and we have to put healthy things out there for kids. If kids are truly healthy, or hungry or thirsty, and they can't go elsewhere, they're going to pick the healthy choice.
Susie, although you have to deal with a lot of tasks in one time, but I think there is correlation between each one of them and the other.
Mm-hmm.
And the fact that family issues, mental health issues, psychological issues, and diet, as well as infectious diseases and contagious diseases and so on, are all correlated.
Yes.
I think this is going to be very successful, no doubt about that, because you put everything in coordination and orchestration in order to reach your goals. Our director, Mr. Michael Peterson, showed us that we have about 1.5 minutes.
Yeah.
So talk to the audience about anything you like to talk about that we didn't cover through all this conversation that was a joy and a delight.
Thank you. I guess I would just like to say that it's all about the student and their success in school and to become successful adults. So their health is very important in that process, and that's physical health, emotional health, and just their social well-being. So we're working together. We all are in this together to make sure that their needs are being met so that kids can be successful at school and as adults.
In the conclusion of this show, I just would like to salute you for your interference, immediate interference with the issue of the landfill fire.
Thank you.
And that you kept the kids under your supervision at least a couple of days when it began. It's unfortunate it still continues. Mm-hmm. It's sad news, very sad news. I wish we can get more response somehow, more solutions. Mm-hmm. But you behaved in the best way, because I've been asked, why they didn't close the schools that day?
Well, our thinking was if we close the schools, then the kids are going to be at home, possibly unsupervised, because parents are working. The majority of our parents are out working.
They would go outside and play?
Yeah, and the kids would go outside and play. So at least by keeping them in the building, then we did not have kids go outside if that plume was overhead or the wind was blowing in such a direction that would affect their health. So they were supervised, they were safe, and they were still learning.
Susie, we appreciate.
Thank you.
You're coming tonight to our show, and this will be, as you know, on Channel 21, and you watch the listing for our audience, and on Channel 18 we are on Saturdays at 2:30 and on Mondays at 7 o'clock, and we are tomorrow on YouTube. So you're welcome to watch and to express your appreciation with us to Susie Walton for a wonderful conversation.
Thank you.
Thank
you. Appreciate it.
And good night, everyone.
Thanks, honey.
Thank you.